And it's very important for cancers of the breast, okay, cancers of the ovary. So kung meron ka niyan, iodine is one of the best mineral that you can take. So
Hi, Dr. Farrah. What protocol is good for stage 3B cancer patient with a bleeding lesion? Not on the nipple, but on the skin above the nipple. Okay. Ano ba yung mga signs and symptoms of breast cancer? Usually, they have a lump in the breast. That's the majority. And if you look at the skin, meron po tayong tinatawag na peau de orang. Okay. So, pag nakita nyo yung breast, para siyang peelings ng orange, diba? So, meron siya para mga pitting, okay, pain, and usually they have lymph nodes, ano, and occasionally nagkakaroon po ng weeping wound. So nagkakaroon tayo ng wound that doesn't heal. So ang tagal-tagal na hindi pa gumagaling. Tapos pain, ayan, yan yung mga most common symptoms of breast cancer. Again, if you talk about cancer, you have, especially for breast cancer, ovarian cancer, you have to change your diet, okay? Kailangan unang-una, do not be eating foods that are rich in sugar. And it's better for you to research on xenoestrogen, GMO, endocrine disruptors. Because these are the more common causes of cancer right now. Ano ho? So, marami yan, mga plastic, ano ho, yung mga kinakain po natin, usually mga nilalagay natin sa katawan, mga shampoo, ayan, yung mga SLS na tinatawag natin, sodium lauryl sulfate, ano, they're not very good for us. So, again, I told you about guyabano leaves, okay? Dapat mainstay na yan. And hindi po totoo yung chismis, ano? Because they're saying
Please address that.
Yeah, they're saying that guyabano can cause anemia, ano ho. Now, this is my take on that, ano. Especially when everyone is demonizing guyabano leaves. I have used guyabano leaves for 15 years already. Ano po, and some of my patients, they have been taking it for years. Ang tagal-tagal na. And some of them, they don't have anemia. Hindi ho sila, they did not develop anemia as a result of guyabano leaves. But some, they develop anemia. But it's not because of the guyabano leaves. It's because of their cancer. Kasi ang cancer ho, one of the symptoms is chronic anemia. Okay, pag may cancer ka, usually may chronic anemia ka din. Okay, so meron ka ding chronic blood loss. So lalo na kapag meron kang problem sa colon, ano, so minsan tumatay ka ng dugo, then you would have chronic blood loss and you would have anemia, but not really with guyabano. So Norge Lisa said, Doktora, ano po bang mabuting inumin ng may breast cyst? Thank you po. Okay, so there was a research about breast cyst, not only breast cyst but ovarian cyst, polycystic kidney disease, and it has been linked to a deficiency in iodine. Okay, so if you have any cyst in any of your body, the best thing to do is to eat foods that are rich in iodine. So what are these foods that are rich in iodine, honey?
Well, a lot of people would say, well, I'll just get more iodized salt.
Okay.
You know, but kelp,
Okay.
kelp is one.
Kelp, nori, mostly these are seaweeds and seafoods, okay? So, but the problem with iodized salt is that it evaporates, okay? So when you open it up, you use it evaporates immediately. 50% is actually gone after that. So it's always better to use seaweeds, okay? Seaweeds always, okay?
So the iodine, okay, there are research that says that it decreases the cyst formation in the breast, in the ovary. Okay, so it's very important for us to eat a lot of iodine, like in seafoods. But the problem is for us to get the 150 microgram. Ang konti lang, no? It's very tiny, 150 microgram. We have to eat so much seaweeds. Sabi nga nila, it's around, if I'm not mistaken, it's around 4 pounds to 5 pounds, okay, of iodine. And it's very important for cancers of the breast, okay, cancers of the ovary. So kung meron ka niyan, iodine is one of the best mineral that you can take. So kung meron ka man